volunteers. We do not get paid. I keep trying to tell my family that. All this work, Mom, and you're not getting paid? Why do you do it? I enjoy it. I'm very happy and honored to serve on the board. Okay, so the board is comprised of employed and paid staff members and the volunteer appointed board. The board, like I said, oversees RNs, LPNs, APRNs, and certified home health aides, which adds up to a little over 206,000 licensees certificates in the state. The volunteer board meets monthly, and we make decisions on about 250 cases each month. So although we meet one day a month, the preparation for that meeting is lengthy. Sometimes there are about 3,000 pages to review. The board members spend hours reviewing those 250 cases before the meeting each month. The board staff members, among other duties, prepare and review documents to endorse and process the licenses and licensees. There are 15 appointed Board of Nursing positions on the volunteer board. The board needs a quorum to carry out the functions, and we currently have 3 vacant positions. We have 1 LPN position that's vacant, 1 RN position that's vacant, and 1 public member, as we recently had 2 resignations. The workload is considerable, and the commitment is essential to perform the work of the board. But if you're interested, please apply. The board also holds investigative inquiries to gather additional information, and we hold hearings as well. This commitment adds up to at least 1 additional day each month. So what's going on at the Board of Nursing? Well, in the late spring of 17, there were a number of unfilled board appointments. The board staff, the paid staff, were working very hard to process licenses, yet there were delays in the processing. The executive director at the time addressed many of these issues and was trying to remedy the license processing. She and the staff worked feverishly to correct the license processing, and they ultimately did. The executive director, unfortunately, shortly thereafter resigned from her position, and in July of 17, she spoke at the Senate Oversight Committee to bring light to some of the issues at the board. In August, the ED had already resigned, and the Board of Nursing was without an executive director. The one and only RN employed by the Board of Nursing, there was only 1 RN, okay, employed by the board, took on the role as an interim executive director. At the end of September in 17, the then governor replaced 10 of the board members, leaving the volunteer board with only 4 experienced members. Anyone who has served on the board can tell you the learning curve is quite steep. The position for the new executive director was posted, and at the end of October 2017, a committee of the board interviewed candidates. The executive director position calls for an RN or an individual when the board deems to have equivalent qualifications to serve as the executive director. Knowing the tight spot of the board at this point and the lack of qualified candidates, as the ED position had been posted 3 times in the previous 18 months, resulting in very few qualified candidates, the committee of the board proposed to hire an executive director who had previously served as a deputy for the board and then acted in the ED position after we lost George. But the committee of the board decided and proposed to hire an executive director who was not a nurse. The board felt that the public and the nursing community would best be served by this individual, and that it was in everyone's best interest. The board is grateful for the support we received from the nursing leaders. Judy, oh, did I say that? Thank you. And be assured the regulation calling for the ED to be a registered nurse still remains. The committee of the board negotiated one condition with the employment of the non-nurse executive director, which was to authorize 2 additional positions, both of whom would be nurses. Because if you recall, we only have 1 employed RN at the board. The board waited 6 months, and in April of 2018, Joanne Leone was named as the acting executive director, and the 2 nursing positions were posted. 1 position is for a full-time director of education, and the other a full-time director of discipline. Interviews were conducted, and both positions were offered to the candidates. We expect them to start shortly, and the board then will be able to continue and move forward with their work. We have a very dedicated board, a hardworking group, and the largest board at the Division of Consumer Affairs. It is my honor and pleasure to serve the citizens of New Jersey. Thank you. Questions? Yes.
2 questions, if I may.
Yes.
Anti-tax member. Of the number of RN programs that you say we have in the state, those are pre-licensed? Okay, let's find the switch.
Better?
Yes, it is. Can you hear me now?
And TriTac? Of those programs that you said that are RN, those are pre-licensure, 'cause those
Yes.
are for the board. Are those physically in the state of New Jersey, or are some of those programs online programs that educate within our state?
I would like to say that they're all in New Jersey, but I would have to double check myself, but yes, they are all in New Jersey, thank you.
Okay, and number 2, I know it's a very heavy workload, and if the members of the board have to travel a distance, has the board considered using electronic resources to help members participate without having physically travel to Newark for those meetings?
It is a very rare occasion that we will do a phone call in or another electronic means. I don't know if they have the support for the other electronics, such as a FaceTime or a GoToMeeting or something like that. And it also needs to be secure, so that's rare.
Just wondering if that might help with people to volunteer, or it has to be appointed because of the distance sometimes is a problem.
Yes.
Thank you.
Mm-hmm. Thank you.
I just have a quick question about medical assistance. And recently, I'm sorry, I'm Joy Anderson, I'm out of Region 3.
Hi, Joy.
And recently I was at the doctor's with my husband, and nurses for years have made our jobs look so easy that doctors think anybody can do it. And I was watching the medical assistant draw lidocaine. So I waited till she got finished because I couldn't believe what I was saying. And I said, what are you doing? She says, oh, I'm preparing the shot for the doctor. He wasn't even in the office. So I went and I called up the medical examiners and I looked at the criteria and I saw that that's one medication that medical assistants cannot draw up. And I'm just a little confused because now that they're getting degreed, they're getting 4-year degree in medical assistance science. The lines are getting blurry. I was reading charts, I see they're doing assistance. So can you explain or tell us how we can protect ourselves, because they say they're like a nurse, even though I know they're not a nurse.
Great question, great question. I have raised this question myself, and in fact, some of the lawyers in the room know that this has come up. It's my understanding that medical assistants are not regulated. So there's no jurisdiction over them. It's my understanding, and correct me if I'm wrong, they are working under the physician. So the physician is ultimately responsible.
So how do we protect ourselves and our family members?
Just to give you a little background from the association, we have been following this because there are two issues. One, there are a lot of folks out there calling themselves nurses who have never been in nursing school for one day. There are physicians out there challenging nurses who question that and stating that they can call them anything they want. There is no title protection for the word nurse in the state of New Jersey, as there are in other states. NJSNA has worked diligently to get legislation introduced that would protect the title of nurse in the state of New Jersey. The second wave of that comes from the National Veterinary Technicians group, who want to now change their schools to become veterinary nurses. And that's just further blurring the lines. So there is a bill that has been introduced for title protection of nursing, and I believe it's all the way through to second reading in the Senate.
Thank you, Ben.
Hi, Mary Ellen Levine, Region 1. So actually it's just a comment, because it probably was a little overwhelming to hear from you about all of the things that you do and the behind the scenes, but those face-to-face meetings, I would like to just comment that they are open to the public. There is a public part of the session, so if you're interested to find out a little bit more in person about what the board does, I highly recommend you can go to the website and look for the meeting schedule and attend the meeting. You'll learn a lot from Barbara, you learn a lot from the board, so I just wanted to make that comment.
Thank you, Mary Ellen. Yes, the meetings are posted on the Division of Consumer Affairs, that's your website, and the board meetings are held the first Friday of the month, except for August. We just do double work in September.
Hi, Barbara. First off, I want to say thank you for your leadership and for all your hard work, and the other members of the board, of course.
Thank you.
An issue that I just want to ask about, I mean, I already know the answer. I guess I don't like the answer, but let me tell you what the problem is.
Could I ask you to state your name?
Yes, you're sure. I'm very concerned about the education of our nurses and the importance of clinical practice. Quite frankly, when you look at the proliferation of all these new nursing programs that are being approved by the Board of Nursing, it really is creating havoc in terms of getting the sufficient number of clinical placements for students. This is a very big concern. And my concern is that if any of our New Jersey schools decided that they wanted to go to New York or some of the other states, they have regulations that would not easily permit that. There's applications, people have to review them, people have to give comment as to whether or not this encroachment would have a negative impact on their schools of nursing having access. But in New Jersey, we just opened the floodgates, and I know this from having been on the board in the past. You know, you're being told, well, you know, there's nothing you can do about it. But New Jersey needs to do something about it, because as more programs continue to get approved, I don't know where people are thinking that these students are going to get their clinical experiences. Those are regulated by the board as well. It's part of the requirements for approval. Somebody really needs to be an advocate to push this issue forward so that the legislators can understand it. I know it's beyond the board, it's a state issue, but you play a very big role because you get to approve those applications. So if you could comment on, is there any movement, is anybody looking at it? You know, what can we do to be helpful to you?
Thank you for your comments, Muriel. Well, one of the things that we are doing is we are hiring, the board is hiring a full-time director of education. As far as programs go and where they have their clinical sites, I know the competition is very stiff out there. Yes, and it's becoming more and more. But the board cannot necessarily not approve a program because there's competition for clinical sites. If the application and the self-study comes in and the school can demonstrate that they have contracts for clinical sites, then those are not grounds for which the board can not approve a program.
But Barbara, here's the issue. Anybody could come forward and say, I have a site. You wouldn't know as a sitting board what impact this is gonna have on other programs that have previously been approved, so you wouldn't know that. And I really would just encourage the board to start to collect some data so that you can take this to the higher ups that you need to within the Division of Consumer Affairs to look at this. But I think they need to see some facts and figures. You may want to do a survey of schools to find out what kind of problems they're having, because those clinical placements are shrinking and there's just, the competition is so great. So if you could look into that, I'd appreciate it.
Thank you. Ben?
Ben Evans. What is the process for determining needs for approving schools?
We actually get, and that was something that one of the board members brought up, we get a report from the New Jersey Collaborating Center, and we review the data from the Collaborating Center, and that is a part of deciding the decision.
Eleanor Dietrich, Withington, Region 6. Barbara, could you share with the group how you handle nurses whose practice is impaired by addiction, with particular emphasis for the students when they take their boards?
Thank you, yes. Well, my students already know about RAMP because I arranged for Terry to come and speak to them. Terry Ivory Brown is the director of RAMP. Terry? Terry and her staff do some very hard work. So just briefly, we are fortunate here in New Jersey because not every state has an alternative to discipline for the impaired nurse. We do here in New Jersey. So a nurse that is impaired has an option of joining and being evaluated by RAMP, where their license is not affected, provided that they participate fully in the RAMP program. RAMP does substance abuse evaluations as well as mental health evaluations.
Focus on when they go for their boards. What happens if they have
Oh, okay, go ahead. Go to the mic and ask that again. I'm sorry. Thank you, Eleanor.
In regards to the students, when they go for their criminal background check for boards, what happens if they've had a DUI before or an arrest or whatever before nursing school?
Okay, thank you. I'm sorry, I didn't understand that fully.
I'm sorry.
Thank you for the clarification. So, and that's a great question because it's often asked. Okay, so the first thing is do not lie. The second thing is do not lie. We will find out. Okay, so if you had in the past a DUI or a disqualifying arrest, do not lie. Let us know about it, speak to it, explain it, and the board will evaluate it. Each one is a case-by-case basis. There are a number of items that are taken into account: the age of the arrest, how many times, what it was for, whether or not it's a disqualifying arrest. all of that is taken into consideration. Documents would be asked for. Please provide every one of those documents because you have a duty to cooperate with the board. So you need to provide those documents. The board reviews those documents and makes a decision. Okay?
Joanne Penn, I have a question, I guess a comment really. NJSNA at our recent board meeting established a task force to study the legalization of marijuana and its effects on nursing. And I really would like some input from you as to whether the board is addressing this situation because it really has a large amount of impact on nursing practice, not only for the nurses themselves, if they decide to partake in marijuana legally, but also patients in terms of utilizing it in the hospital setting or whatever facility they're in. How is the Board of Nursing being visionary with this?
Well, fortunately, the board, as all other boards, are members of the National Council of State Boards of Nursing. So there are some states, as you well know, that have legalized marijuana. So we connect with them, we're getting information from them, but this is something that I lose sleep over. How is this going to work? One of the things that I can say is that a nurse, whether it's alcohol, substances, or marijuana, cannot come to work impaired. So that's pretty clear. So the nurse cannot come to work impaired, whether they have a card or not. You cannot be impaired when you work as a nurse. As far as the patients and how that's going to work out, that I'm not quite sure, but I did see something yesterday that the governor was looking to legalize marijuana by the end of the month.
Yes.
Yes.
That's why I'm asking. Well, it was my understanding there's some hearings going on currently, and by the end of October, so we're gonna get caught behind the 8 ball. And as a ramp facilitator, peer facilitator, I'm just wondering, are we gonna be bombarded with people, nurses, coming into the program or LPNs coming into the peer facilitators in the ramp program because of the marijuana issue?
And Judy Schmidt, Joanne brings up a good point. So if there are any chief nurse officers in the room, it's going to be a challenge for them. If you have a nurse that has some sort of impaired practice, she's now recreational use of marijuana, there is no consistent blood testing. You're either positive or you're negative. It's not like alcohol. So what will happen is they will be testing this nurse, and part of the screens will be marijuana. These nurses will now be reported to the board, and the board will then make the decision whether or not to refer them to ramp. My understanding from Colorado is that all the hospitals in Colorado do random marijuana screenings. So again, this goes back to the board and the Division of Consumer Affairs to see how they're gonna roll that out here in New Jersey. It is really up to the Attorney General, to determine how they're gonna do that. Are we gonna have hospitals now mandated to do random screenings for marijuana? The second thing is giving patients medications with marijuana. Anybody that works in a federally sponsored program, Medicare, Medicaid, it is still on the federal level illegal. So again, we're putting our nurses in a very precarious situation, because as soon as that recreational marijuana becomes legal, the patients and the patients' families are going to have it in the hospitals and the other healthcare settings. So there's a lot of challenges out there. I think the board is trying to address it on their end. We at NJSNA, as Joanne had mentioned, Dr. Evans is calling forth the marijuana task force. We're hoping to get that up and running in November. So we'll try to keep the membership updated on this is a very controversial and a complex topic. And I don't think anybody here in the room has that much information on what we need to do. A lot of questions. Thank you, Joanne, for bringing that up.
Thank you, Judy.
Beth Knox, just a comment in regards to collecting data about nurses and clinical practice sites. I would really encourage you to also collect beyond the undergraduate level, as the graduate level with master's programs, BSN to DNP programs, and our competitor physician assistant programs are just overwhelming our physicians and our APNs here in the state of New Jersey. I think we could also do a better job of trying to mentor our newly graduated APNs to help them develop into good mentors for the graduate level.
Yes, although you know the board does not regulate post-licensure. So it's only the pre-licensure programs that we regulate. So that would really be beyond our jurisdiction.
And I wasn't aware of that. So now I learned something new.
Yes.
Thank you.